Pompe disease is a progressive and potentially life-threatening genetic neuromuscular disorder. When symptoms present in individuals 1 year of age and older, the disease is most often referred to as late-onset Pompe disease, or LOPD. LOPD is characterized by progressive weakness in the trunk and proximal muscles, as well as the group of muscles surrounding the pelvis. This may affect a person's mobility, making it difficult to walk, climb stairs, stand up from a chair, and reach overhead. Weakness in the diaphragm and other respiratory muscles also causes progressive respiratory disease. Since LOPD presents as a spectrum of symptoms that can mimic other neuromuscular disorders, a diagnosis can often be delayed and difficult. One of the visible symptoms of LOPD is difficulty reaching overhead. Scapular winging, a condition in which the shoulder blades stick out, is characteristic of proximal muscle weakness and can be seen in patients with Pompe disease. The following videos were created using motion capture technology of actual patients diagnosed with LOPD. This is Susan, a 50-year-old woman diagnosed with severe LOPD. Weakness in her proximal muscles and shoulders make it challenging to reach overhead, which is typical of a person with LOPD. You can see how Susan struggles to reach for the object overhead and compensates for her limited reach by standing on her tiptoes. You may also notice scapular winging. This is characteristic of Pompe disease and limits mobility of the upper body. This characteristic of LOPD is most noticeable when raising the arms to reach overhead or outward. Brian is a 44-year-old man with severe LOPD. He has a noticeable curvature of the spine, with his lower back curving inward. As characteristic of LOPD patients, he has weakness in his proximal muscles and shoulders. This can make it challenging to reach for objects overhead. Although Brian seems to be able to lift his arms overhead, it's important to take all symptoms and physical abnormalities into consideration. This is Karen, an 18-year-old woman with LOPD. Some patients may be less severely affected or have experienced a shorter disease duration when assessed. It appears that Karen has little difficulty raising her arms to reach for an object overhead. Robert is a 28-year-old man with LOPD who appears to be visibly healthy and asymptomatic. Not all patients with LOPD will portray physical abnormalities characteristic of weak core and proximal muscles. Some patients may be less severely affected or have experienced a shorter disease duration when assessed, so it's important to take all symptoms into consideration, such as general muscle weakness or shortness of breath. If you notice any of these characteristics in your patients, consider a GAA enzyme assay or genetic testing to test for Pompe disease.